Lung cancer will kill more than 140,000 people this year. It's the leading cause of cancer death. November is Lung Cancer Awareness Month, and we want to join the effort in fighting this dread disease. Now, the survival rate past 5 years remains well below other cancers for both men and women, but there are some new clinical trials, new therapies being used to fight this disease. And joining me now, Drs. Boris Murillo and Dr. Richard Helmer. Dr. Murillo with Ascension Providence in the lung group, and Dr. Helmer is a cardiothoracic and vascular surgeon with Ascension Providence. You both work with lung cancer patients. How are the numbers? Sound pretty dire with the number of folks that are diagnosed. Are you seeing any changes in that?
Between 1960 to the 90s, there has been some improvement on the survival of cancer, but since then, the numbers have not changed, and the mortality of lung cancer is still very high.
Well, as we were chatting earlier, I am very personally involved with this. 25 years ago, in the next few weeks, is when my dad passed away from lung cancer. He was a smoker, and so he dealt with that, but he had lung resection surgery, and Dr. Rod Ritchie took care of him, and he lived another 3 years. I mean, it really kind of gave him a gift of another 3 years. What kinds of treatments are there? Are you still doing things the same way as you did 25 years ago? What changes are you seeing?
The principles have remained the same. The treatment plans are a little bit different. At least we have developed a tumor board at Providence, and it's a multidisciplinary situation where we have the surgeon, we have the oncologist, we have the pulmonologist, we also have radiologists and pathologists, and what we do is we take each case and we review it, and we try to tailor that therapy and that treatment plan to that patient, and try to get them the best care and the quickest care possible. And we do that about twice a week, or actually, twice a month, 2 times a week.
Dr. Murillo, of course, the key is always finding this early. So how are we changing things to detect those cancers early?
The monumental problem with lung cancer is that we do not diagnose them early enough to influence the survival of those patients. Mm-hmm. So therefore, it is strongly recommended now that we screen them from them in the same way that we screen for other cancers, such as breast cancer or colon cancer. We can screen patients for lung cancer. So who should be screened for lung cancer? Anyone who particularly smokes cigarettes and has smoked the equivalent to 30 packs of cigarettes per year, or has quit smoking 15 years before the screening takes place. Anybody who is between the ages of 55 and 80 years of age is considered to be a candidate to have a screening. The screening is done with a special kind of CAT scan that has a reduced dose of radiation, and this CAT scan should be done on a yearly basis for 3 years. It's important that you discuss this with your primary care doctor, and the primary care doctor refers you to a hospital that does this type of screening and has a team that it will deal with the results of the CAT scan.
Well, the hope is that more lives can be saved through early detection, and bottom line, stop smoking, correct?
That is correct. 80% of all smokers, or at least women who smoke, develop lung cancer. And the people that have lung cancer in men, 90% of the lung cancer in men were caused from smoking.
Oh, all right. Well, thank you both so much for your time. I wish you a very happy Thanksgiving, but thank you so much for sharing your expertise with us.